We're very proud at Rose Imaging Specialists, having been involved in tomosynthesis from the very beginning, essentially. We were part of the multi-center national trial before tomosynthesis was even FDA approved. And actually, we were the first ones in the country to diagnose someone with a tumor that was only seen on 3D or tomosynthesis. In fact, it was quite interesting. She was the second patient that we did in our screening trial. And I asked her, why did you have this done? She didn't really have a strong family history. And she just said, I've got a 16-year-old daughter, and I want her to have something better when she gets to that age. And very interestingly, she had, to be part of that study, she had to have a regular digital mammogram first, which was read as normal, and I would have read it as normal as well. But when we looked at the 3D study, she had small tumors in each breast. She had one in each breast. An 8-millimeter tumor on the right and a 3-millimeter tumor on the left. And I've been asked, I actually presented that case to the medical panel of the FDA, which helped us get our FDA approval for tomosynthesis. And I've been asked by many people, when do we think we would have found that? And the truth is we don't know, but it probably was years. Not 1 year, not 2, but maybe 3 or 4 years, because she had relatively dense breasts. And that's one of the exciting things about tomosynthesis. It helps us look through all that dense breast tissue and find early tumors. So that was our first role in tomosynthesis before even FDA approval. After having that experience, we decided in our practice to offer tomosynthesis to all of our patients, which was very unique. We didn't charge additional fees at the time, and we allowed everyone to have that study done, which allowed us to produce the very first US study comparing 2D mammography to 3D mammography or tomosynthesis. And that was published in June of 2013 in the American Journal of Oncology. We're very proud of that study because that was the very first of its kind to show in this country what we could do. And what did it show? We showed that we reduced our false positives 37%. That means 37% fewer people had to come in for additional testing. At the same time, we found smaller tumors 54% better. So this was way beyond my expectations. And then, after that experience, we worked with a collaborative group with different groups around the country, including Mass General and University of Pennsylvania and many others around the country. There were 13 centers that were part of this study, and we published the largest study in the world to date on 3D mammography in the Journal of American Medical Association, and that came out in July of 2014. So we have been very instrumental in the research that's done on tomosynthesis, and I personally have done a lot of education. Every radiologist is required to have 8 hours of training before they read tomosynthesis, and I actually am one of the lecturers who puts on those courses. And I've learned a lot by doing it. We in our practice have interpreted over 100,000 tomosynthesis exams, which makes us one of the largest practices in the world with experience using 3D mammography.